Hi everybody, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green, and I am the other audiologist here. So we've just been trying to figure out who this is actually.
I think this is mine.
Yeah, it might be.
I think it's mine because I remember these sort of really fluffy bits on the wax. You've got these sort of really, because I asked the patient, did you use any cotton buds or anything like that? Because we've got this, almost like this, it's borderline whether we were looking at a fungal infection or whether we were looking at cotton bud debris. Okay. I think we may be looking at cotton bud debris here more than fungal infection, but there was this really kind of fluffy debris left on the front of the wax. Wax is rock hard here. I'm just using the Rosen inserter just to try and pull this plug forwards.
It's usually pretty good for these harder, more like tough ones.
It is.
But like I said, these newer ones that we've had feel a bit more flexible.
I think the hook is a little bit longer.
Yeah.
I think that's what it is. Yeah, I think we had some new stock through recently. This is why I think it's cotton bud. You can see the end there. You could see almost a little bits of fluff all the way along, and that back bit there just looks like cotton, although the skin itself is very wet.
Yeah. It's a bit of a weird look.
It's an odd one there. And obviously, eardrum looks really unhealthy, but that's because this patient's had a tympanoplasty. So basically, they've had an eardrum repair. They've patched the eardrum over, usually following perforations or quite large perforations. But other than that, I mean, the ear canal's nice and clear. Just having a good old look around, yeah, it's quite messy. Isn't it?
Yeah, quite lucky that came out in one go, actually.
Yeah, I think I wouldn't want to fight with that up against the eardrum. I really wouldn't.
No.
So just over a centimetre, just under half an inch.
Yeah, half an inch.
I think we're alternating in this one.
Yeah, I think there's a few in this one we said earlier.
Make sure you stay tuned for the last one as well. That's quite an interesting one. You did see something similar a couple of, sort of last week or a week before, I think it was. But yeah, check that one out. Sorry, Taylor.
That's all right. So yeah, very bright here, very narrow as well, this one. But I'm actually, the reason the suction is sort of off on the side here, I'm planting the camera against the ear canal here. Sorry it's so bright. I can't remember if I actually changed the brightness down a level on this one, but you can just kind of see the ear canal wall is just in view there. So I'm actually having to hold this ear canal open with the camera while we're giving this a good old wiggle to try and get this out. Pretty tricky one, to be fair.
Oh, that's a good size piece.
Yeah.
When you see that in relation to the size of the ear canal, that was pretty full in there, wasn't
it? Just tidying up these little bits of dead skin here. I think it's dead skin on these little bits. Yeah, you can see the blockage is clear already. Just tidying up these last little bits with the fine end. I just jumped away. Yeah, bit intermittent, those ones. Sometimes they come away really nicely. Sometimes they just become a bit of a pain.
You never know where you're going to get. It's very sludgy. Obviously a lot of oil got in this one then. Yeah,
and you can see not a full ear. So you can see the eardrum in the background on this one. I think we do. I think this is the fine end still that we've got on here. Again, quite a narrow end. I probably could have fitted the standard size tube quite easily here, but because there's only little bits left, we want to try and keep the noise to a minimum, really, which is impossible with the suction, but
especially if you've got like that one there was a block that wasn't blocked up as such, but there was a block of wax in there, but there was a gap at the top.
Yeah,
we want to minimize the risk of minimize the time we spend in there with the suction. If it's got quite an open ear canal, it doesn't really need really kind of loud suction going in.
Yeah, and you can see it's very light material as well, so very typical of dead skin.
Yeah.
That's obviously trying to migrate out of the ear and just hasn't quite got there.
Just got out of it, but not gone any further. And that happens quite a lot in patients, doesn't it? They tend to sort of get this dryness to the outer part of the ear canal. Happens as we get older, we produce less and less oil in there, and it just dries it out a little bit. Eardrum looks nice though.
Yeah, got your light reflex there. Yeah, looking good. Patient obviously hearing much better. There was only one of the plugs on this one because the other plug basically just suctioned away into the tank, so we didn't have anything else on that one, unfortunately.
Ooh, I'm not sure about this one. I think this is yours. It looks like yours. Doesn't look like my superior camera. No. It looks like
your prestige camera.
Your prestige camera.
I got the little cheapy one I have.
That's right, yeah. That's the one we've got.
It's not a cheapy.
It's one of those ones like mechanics use to look through the engines and stuff. That's the one you've got.
Yeah. So yeah, dry skin again on this one.
That's very dry, isn't it?
Yeah, I seem to be getting like really awkward ones in recently.
Do you know what? You do seem to have a bit of a run. In fairness, I think we had a real run of difficult cases, a lot of very difficult cases, and I've had a few easier ones in the last couple of days, but you're
Yeah,
still
just
getting lots of difficult stuff.
yeah, but it could dry like musket ball or like
Yeah.
like a BB pellet
Yeah.
of wax that's in there. Quite solid as well.
Lots of hairs, like a little tumbleweed, isn't there, sitting down in there?
Yeah, I was quite lucky to get a relatively decent suction grip on this, because sometimes these really dry bits just tend to roll around and not really play ball, which you can see me fighting with this. I think I may swap to...
Oh, you're going to use it like just drop over the top of the
Yeah.
side of the fine end. Sometimes I'll just be enough to roll. There you go. So
there
roll
we are.
them out.
I was going to say, I think I do swap with the manual tool, but obviously we've used the suction as a manual tool, used the Zollner tube as a manual tool.
Sometimes it's easier to do, isn't it? You've got it in there anyway. If you can just go over the top and just roll it forwards rather than get another tool out. Oh, perfect eardrum. Look at that.
That is textbook.
That is literally an audiology textbook eardrum.
Yeah.
You never see an eardrum like that, ever.
If you want to know what a perfect eardrum is, that's a perfect eardrum.
That's the one. That's the one. Well, yeah, teeny little bit there. I mean, I forgot to see what it was in centimeters, but that's just under half an inch, I would say.
Yeah, that's a centimetre.
Oh, look at that. That is dry.
Is that me again, or is that you?
I'm not sure about that one. I don't know, but
Oh,
that
goodness,
is
this is
dry one.
We don't know any of these, right?
What you can remember, guys, is we do a lot. Well, obviously, we see a lot of patients every day, and we think, well, that would be a nice one for YouTube, and we pop it into a folder, and I sort of edit some of them in then as we're going along. So we might not see some of these for a couple of weeks and go back to.
This again looks like my kind of quality camera, to be honest.
It does.
Super dry.
Oh, I'm going to have to give that a little bit of a wiggle there, though.
You can see how it was kind of stuck to the ear. Yeah, it just needs a good old pull, this one.
It's almost skin ribbony, isn't it?
I think there is a little bit of a ribbon on this one, actually.
Just a little bit.
I'm outside of the ear now, so you can see this start. This one does shear away, though. I think it does. I don't think you can see it's just not moving at all now. Yeah, it's sheared off there.
It's almost like a little bit of keratin, isn't it? It's just not a little bit, a long strip of keratin.
Yeah. Sorry for the view there, guys. I was actually using my own line of sight because it was actually outside of the ear, so I wasn't using the camera at that point. I was using my line of sight with this one.
Because we're a bit further away when you're bringing these right out, sometimes it's difficult to keep the endoscope in view, isn't it? Or the view inside the endoscope. So it's easier sometimes you look over the top and use your eyes and pull it back with the endoscope will naturally drift away from what you're looking at.
Yeah. So you can see why that wasn't coming out. This last bit was really kind of wedged in there.
Yeah.
You can see we've left a little bit further into the ear.
Yeah. A
bit of oil, yeah, a bit of oil just to try and more than anything, just to try and reduce the clarineting.
Yeah.
Because like you see this little bit that's kind of like flapping in the tube there. Now, even that tiny little bit, you'll be surprised, can make a horrible noise when it goes inside the suction tube.
Yeah. And you do, as soon as you get that, you withdraw straight away then. So you're getting that out of the ear as quick as you can. And then switching down to the fine end.
See, you can see how we're trying to maneuver around it, but it just kind of draws itself in. It's not clarineting at this point because I would have come straight back out if it was. But yeah, deeper, dry, very, very dry, this kind of wax in here. And I think there's another bit that's left in there as well.
Yeah, looks like it is further in there, doesn't it?
We're literally just coming away in plates at the moment.
You can see how that sort of, that very surface keratin layer is lifting from the canal there, just like Taylor said, just jumping up into the suction. Sometimes you're better off just saying, right, I'm going to go in there, just going to get rid of that bit.
Yeah, so we've swapped to a fine end here now just to try and get this little annoying bit away. So you try to draw these little bits of skin in. You can see it just slowly starting to suction in here now. That gives you a better grip, and generally it tends to slip out from underneath that wax.
Yeah.
Which it's obviously not at the moment. But
it is, yeah. It's really hanging on there, isn't it? Don't forget, guys, if you do enjoy these videos, you can always like, share, follow, subscribe. And if you do have any ear problems yourself, whether that be wax or hearing issues, you can always check out our bio or the channel page. You'll have a link to our website, and there you can book yourself an appointment with the lovely, ever so lovely Mr. Taylor Green.
It's getting better.
It is, I know. Oh, myself. You can obviously want to us. So you can come along and see us. This is really just angular and hard and difficult to get out, isn't it? It's really wedged in there.
As I'm moving this side to side, you can almost kind of see it looks almost like crystallized. With how dry this is, you can see it just almost like if you can imagine like a cluster of crystals, like kind of shining in a light. You can almost kind of see that on the surface. It's a bit of a difficult one to do sometimes.
It's not easy.
But we got really lucky to take this whole. I think that might be it. I lied.
There's more in there.
I lied.
Goodness me.
I do apologise.
Well, it's sort of got that almost that rough crystal kind of quality to it. It's really difficult to get a good suction grip as well, isn't it? You just can't quite get the angles.
Eardrum, eardrum is in view now. So this is, it's just jumped up. I'm so glad that happened.
Yeah. So because that drum doesn't look healthy.
Is this the last one? This is the...
I think it might be. I'm not too sure. Yeah, there you go. You can see there. I think we've put a couple of arrows on here. Might not have. I don't know. I thought I did. Maybe I did. Can't remember. Yes, there you go.
So yeah, kind of like what we've seen a couple of days ago, last week.
Yeah.
You got these kind of like retraction. You can see in the pars flaccida there, just above the eardrum. You can see it kind of sucking inwards. Yeah. And then you've got this other pocket on the pars tensor, which is, again, also kind of sucking in.
It's that posterior section again, isn't it? Yeah. We talked about this last time with that posterior section, which posterior just means, if you imagine posterior is your backside, so it's the backside of your head. But that bit that's furthest to the back there doesn't have as many of those fibres inside that particular part of the pars tensor, so it's more likely to act as a retraction pocket at that point. What we also did point out now and then was the incudostapedial joint, which is basically where the incus and the stapes meet. You don't see that very often unless the eardrum is really, really retracted, which is what we showed you on there. We could say that was possibly, I think that's more retraction pocket than atelectasis. That's right.
Oh, well done.
Thank you.
I'm glad you remembered it.
That's guys, the one word neither of us can say. We try every single time to say it. Just because it was acting, although it was because it was acting on the pars flaccida as well as the pars tensor. I think that's more likely to be a retraction pocket in both those rather than atelectasis.
Yeah.
There you go.
Obviously, depending on the severity or the grade of that kind of pocket, the retraction pocket. A lot of patients may sort of experience a small conductive hearing loss. Yeah. That normally shows up on the audiogram once, testing afterwards.
Yeah. So I mean, for this one, we've kind of talked over most of this, but we had this piece of wax that was really, really jammed up against the eardrum, this one, and dry. Not quite as dry as yours, in fairness. Just because it's got that slightly lighter colour to it.
You can see it's just starting to move.
Yeah, no wax anywhere else in the ear canal apart from down on the eardrum. So this is just somebody's pushed something in here to get this down. They've cleaned their ears with stuff they shouldn't be cleaning their ears with, and it's all ended up down on top of the eardrum. So a patient was really having quite a few hearing difficulties because a rule of thumb, deeper that wax goes, just more problems it causes, don't it, with hearing.
I've had a couple of patients saying, I only use my finger to clear my ears out. And I'm like, well, unless your ear canal is like this big,
like a really tiny...
or a really tiny finger.
What's those things, AIs? Those little, like, they go like, have you seen those? They live in a jungle somewhere. They got like a really long, like, middle finger. They tap wood to get...
I don't know what they're called, though.
Yeah, one of those. Perhaps they're like that. Perhaps they've got like that. Like one really long finger. They can get in there. Finger. They can go right in there. Anyway, we're taking away some more of the dry stuff here just for this top part of the ear there. So this is your kind of epitympanium that's just above the eardrum here. It's always a good place to look out if you're looking for ear health as well. Lots of, we're taught as practitioners to look at the eardrum. We look at it as a clock face. You start off at 12 o'clock. And what you're doing there is not only you checking the eardrum, but you're looking at the section above the eardrum, because if you're going to get problems, you're more likely to get things like cholesteatomas, keratin buildup in that area with that pars flaccida, so that just that slightly thinner part of the eardrum that's more susceptible to pressure change behind the eardrum there. Same on this side. The patient wasn't really having major issues, but just having more of an annoyance in the ear canal here. So I did say there was a bit of wax down on the eardrum. We'll get rid of that now. So that's what we've done on this side.
crispy.
It is like a cornflake.
I love cornflakes.
Yeah, I wouldn't fancy that one, no.
Although you wouldn't know if it's in your bowl.
Yeah, but that's, do you know what? I'm going to pull out the test here. Next time you come in, bring cornflakes in for breakfast at work. I'm going to slip one in and see if you notice. But there you go, just little tiny bits, just over 2 centimetres and just under an inch. Weirdly, talking about, so we talked once, we were all about doing Operation. You know the game Operation?
Oh, yeah.
About Steady Hands. Somebody put in the comments, it might be a good one to do on one of the 100 episodes. We'll have an Operation Off.
An operation off.
Me and the Operation.
Sounds good.
Bring it on.
But,
I quite like the sound of that. It sounds like a fun thing to do.
Yeah, it's a good.
That'll
be a good little blog, though.
It's a little bracing technique. We'll have to work out what we put in there, though. We'll have to make it more difficult because the standard stuff's too easy.
That sounds like a plan, actually.
I might have a Minions one in the house we could use, maybe, I don't know.
That sounds like a plan.
We'll have a go with that. Anyway, we went off topic a little bit there. Again, my fault. But as always, guys, take care of yourselves. Thanks very much for what today. And as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another. And be the lovely, lovely, lovely Mr. Taylor Green.
I was going to...
I will see you again for the next one. Bye, everyone.
Bye.